exciting episode of Health Check. It's on Hope TV, where you look and live. My name is Kerry Kagiri, and today we have a conversation that directly affects me just because of God's decision for me to be born as the female gender. I'm going to be going through this, and many of you need to call your sisters, your moms. Probably they went through this and they didn't even realize what was going on with their bodies and their minds at a certain time. Yes, the conversation is on menopause. Yes, gentlemen, you better stay around because we need your support as we go through this amazing season of life as God created it. And as always, we have specialists in studio. Today we have Dr. Muthoni Gichu.
Thank you.
You could please explain to our audience what that practice is all about.
Basically, a gerontologist looks after and sorts issues of older persons. So when you talk about older person, we're talking about people who are 60 years and above. Yes.
Watu mko 60. Acheni kusema you're young at heart. Just move on. They are young at heart. Oh, sorry. Your doctor is defending you. And as always, this is one of our resident gynecologists, obstetrician, Dr. Wachira Murage. Karibu tena. Stages of menopause. What are some of the stages that women go through?
We could look them at, as in we can actually classify them as three, because there is pre-menopause, that is before, then there's a menopause period, and then there's a post-menopausal period. So we could look at it in those three categories.
Okay.
Yes.
And what are some of the things that happen in pre-menopause and post?
And post.
Okay, let's start with
Right.
pre. Let's start with pre.
Okay. So basically, Dr. talked about the menses pausing. So what happens at this time is that there is irregularity of the periods. And then there are many other things that come with it. You will find that people say they're feeling too hot. Or I have an experience of a lady I used to sit with. I didn't know what she was going through then. But anytime we sat and there was a bulb, she would say she's feeling hot. So later, that is when I tried to figure out where is this heat coming from. So what they call heat flashes. Sometimes they could actually be feeling hot at night. And then again, this again affects their sleep. They get to lose sleep, something we call insomnia. And it could get to a point where they feel fatigued, they're irritable, they're moody, you know this thing we call about moody, it has been shown to come with the periods from an early age.
Yes.
And even during premenopausal period, it happens again.
Okay. What are some of the symptoms that ladies, when they come up to you, what are some of the things they say they're experiencing?
Okay, thank you very much. And you had promised to tell them, the men, about the menstrual cycle.
Please.
So let's mention before they start saying.
Let's do it.
Yeah, so the menstrual cycle is an event. We say it's a cyclical event that happens in the ladies. And it's normally about 28 days. It can vary from 21 to 35. You have short cycles, you have long cycles. So this is a hormonal change. So you have the time for periods, when the lining of the uterus sloughs off and comes out of periods, which takes about 3 to 7 days. And then from that 7 days to about 14 days, there's proliferative phase. So that whatever sloughed off is now building up. And then you have around the 14th day, you have ovulation. And then if there's no pregnancy, that lining plateaus until around 28 days, then it sloughs off. So there is interplay of various hormones, follicle-stimulating hormone, luteinizing hormone, and others, to be able to bring that menstrual cycle. So it's something that happens from age 15 to 49, depending. It may come earlier, it may extend a bit, but that is what is called the reproductive age group, and that is the time that it happens.
Okay.
Okay. Back to the signs and symptoms of menopause. Dr. Muthoni has mentioned that they can have what is called hot flashes. And those are what we call vasomotor symptoms. A lady will say the feeling hot, and the part of the face and the neck, kind of like blushes. If it's a brown person, they'll flash off and then see that wave of heatness, and then they sweat. So that is the most of the time that is really, really common. The ladies may feel a bit, depressed sometimes. They don't want to talk to anyone. They just want to be quiet. Then you have other things that can happen in the urinary system. they can get recurrent urinary tract infections. So they will be feeling, they feel like peeing all the time. And this is because they have lost estrogen. Menopause is about losing estrogen. If you have a block or loss of estrogen, then it means that the lady is not able to hold the organs tight the way they were before. And some of the organs that are affected is the bladder. And therefore the bladder will be kind of loose. So they'll be feeling like they want, to pee. We normally call it urethral syndrome, if you like, they want to pee. Then you can have vagina, the female outer organ. It also thins out, so they may feel irritation. And the marital, that is sex, they might also feel some bit of pain, and they may feel vaginal dryness. So those are some of the common symptoms that we do get in women when they're developing menopause.
You talked about depression. I thought even there's aggression as well.
Yes, there can be aggression, but most of the time
it's depression.
Most of the time is depression.
Okay, absolutely.
Yes. Yeah.
Let's talk about post. What happens in the post season?
The periods will definitely disappear. You see, the fact that estrogen has gone lower, it means that these people are more exposed to weaker bones, something we call osteoporosis. And that is why it is important to be able to manage the effects of the reduction in the hormone. Some of these things, actually the interesting part is that you could find that it could take 8 years from pre to post. So they could have all the symptoms we're talking about, 4 years pre and 4 years post. Could actually go up to 12. So you can imagine somebody who gets into menopause or the symptoms begin at 48, they'll go with this to the time when they're 60. So that is likely to happen. And then again, definitely after that, we do need to talk about family planning because chances of getting pregnant are low. So now that again opens another phase of life that we need to think about and talk about when we get to menopause.
Absolutely. Why don't you talk about it now? What are we waiting for?
Yeah, but think about it. When you talk about older persons, and we need to talk about sexuality and intimacy, is one of the things we find as a taboo. But ideally, the fact is, older persons, male, female, have needs. They are probably in a marital setting. Will you tell them not to have sexual intercourse because menopause has come or because they're old? So again, remember, this is probably somebody who will need to go for STI checking, or for example, if they have a urinary tract infection, which again can be shown by or is presented as frequency in urination, like Dr. Wachira said. And then again, we could also have something we call urinary incontinence, which is quite common in older persons. So if all these things are not managed, again, remember, if an older person goes to a health facility, the response they're likely to have is, what are you doing here? Or the very common thing, "Niuze inakusumbua." The last I checked, there's no condition called uze. And then again, the fact that older persons will continue having sexual intercourse also means that they will need health services that respond to prevention of STIs, HIV. So we cannot say that simply because menopause has come, the things that need stop. Actually, it's a phase of life. So now there's nothing about, they don't have to worry about getting pregnant for the women. So what does that mean?
Okay, that's a good conversation right there. I see Dr. here, it's all about the rights of the older people. Her patience, she's like haki yao. I absolutely love it. As we continue, how do we diagnose menopause?
Yes, of course, from the clinical aspect, because there's the history taking and the way they present. The few things that we have mentioned together with the Daktari, so we take a good history. The menstrual irregularity, you find the lady will start having irregular periods, okay, or no periods at all. And then, of course, they will have now the hot flashes, the sweating. They'll complain of, vaginal pain, the urethral syndrome that she just explained so well. Then you can go to now to laboratory investigations that you can do. And you can do a hormone called FSH, follicle-stimulating hormone, and LH. You can do prolactin. So those are hormones that you can do, and they're going to give you a very, very good indication. Then, of course, now there are bone changes, the osteoporosis that she has just mentioned, and this is decrease in bone density. But the follicle-stimulating hormone, the luteinizing hormone, the FSH, LH, are going to give you a very, very good indicator. And of course, then it goes with a clinical, setting. You are looking at the age. You mentioned premature menopause, and that one can come to, by other causes, because a young person.
That's where we're actually going to. You're like a
going.
prophet. Please, honestly, answer that question, because I was actually going to ask, what causes early menopause?
Early menopause, yes, yeah. So you can have, sometimes you don't know the cause. Call it idiopathic, menopause. A lady will come, you do all the tests, but you cannot get, and it's a young person, you cannot get the cause of the menopause. Of course, others are drugs, like cancer drugs. They can cause that. Others are surgeries, like a lady losing ovaries due to some other complication, maybe ovarian cyst, maybe cancer of the ovary. So all those causes. So it can be drugs, it can be surgical, it can be idiopathic, and many other causes that can cause premature menopause. But basically, you combine the clinical, what you're getting the clinical, look at the age and what have you, and then you look at now, you do the laboratory investigations and then radiological investigations. Once you combine, then you know that the lady is in menopause.
Absolutely. I'm coming to you, Dr. Muthoni, just to ask, what are some of the disorders, complications resulting, and possibly some that are increased by menopause? But as you do that, just joined us, the conversation is on menopause. And it's something that happens to all women. And so if you are a woman, you were born by a woman, stay tuned and learn everything you have to do with this particular conversation. You can send in your questions. Please start sending them early on to 22232. We're also available for call. After we go on a break, our call lines will all be open and you can ask our doctors all the questions you might have. So what would you say? What are some of the disorders, complications that result with menopause?
All right. So remember we talked about urinary incontinence.
Yes.
So that is one of the things that actually comes as a complication with menopause. Not to say that it cannot be addressed. It can be addressed. Then you'll find that after menopause, women are more exposed to heart conditions, because remember, estrogen has a protective role when it comes to protecting the women against or from heart conditions. We also have fractures. You will feel that these are very common finding that, Shusho fell and she broke her hand, or some fractures, even fractures of the hip joint. They actually become more common in older persons. Why? Because menopause has come in. And then again, we won't forget the story of STIs. We are in a setting where older women will look for younger men for whatever reasons, and that is something that we have not talked about. We do not even think about. I will ask you a question. Have you ever thought that your mom and dad could actually be engaging in sex?
They should be.
But you see, when you ask someone, they'll be like, saying, no, as in, you don't even want to, you don't want to talk about it. So where does that leave us? It leaves us stigmatizing those people.
That's true.
Yes.
Oh, yeah. Someone told me a very stigmatizing story of their parents, but we won't go there.
Yes.
So that's good. Good on you, folks. Okay, I hear you. Probably the question would be the emotions part. People would say, oh, you're menopause, the one and behave this way. Where does that come in?
You see, remember we talked about people being moody, irritable, depressed. So once we're able to actually, you see the way we're working so hard to talk about menstrual hygiene and making sure that everybody knows about it and is able to support it. Same thing we need to have when talking about menopause. Because again, if we're able to understand where these people are or where we will be at that time, and we have the support, then I believe it's one of the reasons as to why, or it's one of the issues that can actually work very well to be able to work in this space. Because once we talk about and educate people about and empower people about it, then we are also able to identify where we are at. So that means like, oh yeah, there's this body thing. It can always be managed. There's a depression. We don't have to go into depression. Then again, remember, when menopause is coming, is actually when the children are moving away from home. So we have to deal with empty nest syndrome on top of menopause. And then probably people are changing how or where they used to work at, probably early retirement or something of that sort. So when you put all those things together.
It's a lot. Absolutely. The mind and menopause.
Yep.
Those two seem to have a correlation. When I was trying to Google on the topic, that's most of the things that popped up, especially from TEDx. You know, it was mostly how menopause affects a woman's mind. Until women think they are losing it. I'm hallucinating, I'm having this. What can you say? Say something to the ladies going through this right now, or the people who are watching people going through and they don't know how to give them support. What would you say?
Yeah, it's really a key thing. And just before I go to that, just to add on what Dr. Muthoni has said, and something that it's probably the domain of the gynecologist, is genital prolapse. Yeah, we tend to also get quite a good share of genital prolapse, where the uterus comes down and therefore they may have to undergo surgery to correct that, most of the time to remove the uterus and be able to hold the bladder in place. Yes, I do think, as you said, it's really a family issue when you're talking about menopause. And just like we talk about pregnancy and the changes in pregnancy, there are also changes, as she has alluded to very well, that come with menopause. The issue about someone become irritable, looking a bit depressed, and all that. If the family do not understand that such a thing can happen during menopause, then they might be construed either to be rude or to be disobedient to the husband, and not wanting to cooperate with the family, and that can affect the unity in the family. And therefore, psychotherapy most of the time is required. Psycho support, right from the family, and of course, if you need services for a psychotherapist, it may be very, very important, because in some ladies it really takes toll in their minds. Yeah.
Okay.
Yeah.
Absolutely, quite interesting. We were honestly going to menopause symptoms, sexual dysfunction, the negative impact and quality of life for women, and how they can be helped to optimize their health and their quality of life. What did you say to that?
Okay, so yeah, when with menopause, there's definitely a decrease in the sex drive, but that does not mean that life ends. It's actually a time, like I said, it's a new phase. It's a new phase to discover what else works. And then you'll find that as people grow older, sexual engagement may lessen, but the issue of intimacy actually goes higher.
Yeah.
So that's why you'll find older couples holding hands as they walk, and they're fine, and they're happy. So it's just about trying to figure out what works for a couple, for example. And then it is important to have support groups, where people openly speak about these things. And then remember, like Daktari said from the very beginning, as a female species is going through menopause, there is also, on the other side, male species going through andropause. So this menopause is not happening in isolation. Yeah, so it's a good time to actually find out what else works in life. Yes.
I love that. I absolutely love that. And this conversation is going into mostly saying that getting into menopause is just a new stage, and you need to discover what that will be like for you. Prepare emotionally, learn, educate those around you, work together with your partner. I'm just curious about andropause. If we could just talk about it for a second. What are some of the things the guys go through?
The men basically go almost similar things.
Okay.
Yeah, so there's that sweating. There's also the psychological bit. So you see the man is a bit quiet, not wanting to, to talk so much. They can also be very, very also quite irrational. They can be very aggressive. Okay, and of course the libido may go down, and they may suffer, ESDs, the erectosexual dysfunctions. So they go almost to a parallel kind of, signs and symptoms as the ladies.
Well, we want to learn about treatment, but we'll be going to a break right now, and just getting back to this. But how can we treat menopause? I'm really curious. And also, how can we continue to support our mothers, our sisters, our general public when they're going through this new phase of life? I like how you put it. It's a new phase of life. How can we support? We'll be back after this break. You are on Health Check. It's on Hope TV, where you look and live. Keep your questions coming on 22232. We'll be responding to them. My name is Kerry Kagiri. I'm hanging out with Gerontologist. I think I'm getting worse at saying. Please say.
Gerontologist.
Gerontologist. Her name is Muthoni Gichu. Absolutely delighted to have you. And a gerontologist, for those who just joined us, deals with health of older people in the society.
Yes, you see the way children have a doctor who's a pediatrician.
Oh, pediatrician.
Yes.
Yeah. I knew that. I just wanted you to say it. And then we also have our gynecologist obstetrician, Dr. Wachira Murage. Thank you for joining us once again. We'll be right back. Thank you for staying with us on Health Check on Hope TV, where you look and live. My name is Kerry Kagiri, and today's conversation is when the menstrual flow stops. Menopause.
Yes.
Am I with it?
Yes,
Okay.
yes.
That's the simplest description given to us by Dr. Wachira Murage, who's a gynecologist, obstetrician with us on site. Thank you for joining us. And also on my right, gerontologist, which is the opposite of a pediatrician. So for people over 60, but even people who feel old at heart can come and see you.
We'll have the discussion.
Oh, you'll have the discussion.
Yes.
Okay, good. Dr. Muthoni Gichu also in the building. We've talked about some of the causes. We've talked about what menopause really looks like, some of the symptoms. And if you'd like to catch up with us, you do that on YouTube. So get in touch with our content. You can listen to our content from last year, even on Facebook as well. So catch up with that. We said when we are back after the break, we'll be talking about treatment of menopause. So what are some of the things you do? Let me start with ladies first. Dr. Muthoni, what's the treatment for menopause?
This is where I also ask a question. Do we need to treat menopause?
Do
Because
we?
it is not a medical condition. It is a phase. So do we need to treat menopause, or do we need to support people to go through menopause? However, again, the beauty about the world is that it has choices. So when you look at lifestyle, exercise is very important. Again, remember, estrogen goes down and the bones become weak. The heart is exposed, as in there's a higher risk of a heart condition. But when people, there's also the irritability, the mood, the depression. Exercise is actually able to work around and improve all these symptoms. A healthy diet, again, learning how to sleep. Remember, we had insomnia. So learning how to sleep at this time is important. And then with the hot flashes, it means what we call dressing in layers, as in you wear clothes such that you can actually get off what you do not need when it is too hot. Then again, having social interaction is important. So that is one of the ways that we can use to manage the symptoms that come with menopause. Yeah.
I like that. But isn't the reduction of estrogen kind of a healing for people with like fibroids and some of these things? Is it like a blessing? Because like when you have fibroids, you're just thinking, please don't produce estrogen in my body. Fibroids are going to feed on the estrogen and become bigger and bigger. Like there's some of the blessings that come with menopause, right?
Oh, yes. As you said, yes, it is. I mean, we normally don't treat all fibroids. Yeah, if you're about 47, 48, and you're having some fibroids, you normally say, why don't you use the medical treatment as we wait for menopause? So in a way, you can say that.
Yeah.
But of course, you cannot equate fibroids and menopause.
It's true.
Those are
You
different
can't.
things.
Sorry.
Yeah.
I'm
Yes,
just thinking, no estrogen.
as Dr. Ria said, yes, we do want to start on non-medical interventions, just as she has quite well elaborated. So we don't want to go into medications unless you are really pushed. As she said, there are choices, because you get those patients that have really severe osteoporosis. There are those patients that will have cardiovascular diseases and risk of atherosclerosis. The heart, the cardiac issues and accumulation of some stuff in the blood vessels. So those ones you may attempt to treat, but the majority of the ladies in menopause, you do not need to do medical treatment. You just start with lifestyle changes, then you can go to dietary adjustments, you know, and before you go to treatments. However, there are some patients that you may need to treat because it's affecting the activities of daily living. Because there are ladies who come to your office and say, oh, Daktari, this sweating is so much. Even when I go to Chama, I'm embarrassed. I cannot do this. I cannot sleep. I cannot even talk to my people. I feel really bad. And if you categorize such a patient, then you may attempt to treat, but you do not go straight to replacing the estrogens, because that's another topic altogether. Yes. You want to start with, you know, with vitamins, you know, calcium, the dietary. And these days there are also soya-based compounds that are not hormones. You want to start with those ones before, if the situation improves and requires, that's when now you can consider the hormone replacement treatments, which we reserve to a very, very small category of patients. But basically, that is the way we go about the treatment of menopause.
How about the mind?
Mind, as you said, you want to start with the family. These are patients that, or not patients, they're really not patients, but a group of us that you need support. We need to understand, yes, that they are in menopause and they are for certain things. That is why a program like this is very important, because we will educate people and know that menopause is really not a disease. As she like to put it, it's another phase. And all of us are heading there. Any time from 52 years going forward, then we will be that kind of a new phase of life. So mind, we want to start by group therapy, you know. Family, then you can go to groups, the support groups that she talked about. And if the situation arises, then you can bring in not even a psychiatrist to begin with. You want to start with a psychotherapist who can discuss issues.
Talk therapy.
Talk therapy.
Yeah.
Discuss issues, make people understand, educate people at the family level. You know, the people staying with the lady, that this is likely to happen. And they see that if they are respected and they are considered and their opinions are respected, they'll find that they adapt very well. Before then, you can go to, you know, to the psychiatrist and so on and so forth.
Absolutely. Our call line is now officially open. You can call and ask Dr. Muthoni any questions you have, Dr. Wachira, any questions you might have. But I have some on 22232. That's this text line, 22232. I have some, it's on your screen. Our call number is on your screen. You can go ahead and call as we continue. One is asking, Daktari, how can I know I'm on menopause without confusing it with other conditions?
There are the common symptoms that you will find. But again, it's always good to visit your healthcare provider just to also get a confirmation. And anyway, there's nothing wrong with a second opinion, even a third one if you need to. So once you look about through the symptoms you have talked about, you can always visit your healthcare provider just for confirmation.
Okay.
And also, you can also have the tests, like Terry said, and we either confirm or rule out and probably look for other reasons why somebody could be thinking they're actually at menopause. And then
So stop self-diagnosing.
Yeah.
Yeah, okay.
Yeah,
Whereas you do that for COVID,
they actually
many people
would
are
need to go
self-diagnosed.
to, as she says, you need to go to a doctor, because you need to do a number of tests, as you said, because they are now what we would call differential diagnosis. Because other diseases, cerebral malaria, you know, liver diseases, kidney diseases, diabetes, hypertension, can kind of mimic menopause. So there's a whole lot of investigations that she has alluded to that you're going to do. And therefore, as you say, there should be no self-diagnosis.
Yes.
You should actually go for a checkup because it's confirmed that they are in menopause.
I have to take this moment to say, even for COVID, don't ask, Kerry, what were your symptoms? My symptoms are not your symptoms. There's someone who had all the symptoms I had, but then they had a bacterial infection and they didn't have COVID. So be sure to get a test. COVID tests are available for you. So go ahead and get it. As we talk about that, what causes the sweating? Sorry, I just remembered I had that question at the back of my mind. What causes this Is it hyperventilation? No, sweating.
Yeah, the sweating. Yeah, it's basically the estrogen.
Oh, okay.
It's lacking. Yeah.
So it wasn't even the bulb for your friend.
They believed, as in, when they talked about when they sit, for example, where we're seated and there is light, would say they're feeling hot. But I could never relate the menopause process and the hot flashes.
Yeah.
Later is when I actually asked them, and how old are you? Like, oh yeah, that could actually be what is actually we're dealing with. But
okay.
Yes, so it's actually the estrogen. The estrogen does a lot for the lady. A lot. It's what hold the systems. And you basically see there's a difference when they get into menopause. You know, there's wrinkling of the skin and all those things that you have mentioned. So temperature regulation as well falls in that category.
Any relation between menopause and Alzheimer's?
What happens is with menopause, it has been shown to have some cognitive decline. However, this cognitive decline is not necessarily Alzheimer's or dementia. And there's a lot that can be done about it. Again, remember, when you're talking about social interactions, actually, you know, when you learn how to dance, you actually activate a lot of systems or nerves in the brain. When you learn a new skill, for example, dancing is just an example, maybe because I like dancing.
Yeah.
So it's a time for people need to reinvent themselves as these other things come into life. That way we're able to handle the cognitive decline that could present with menopause. So it is not necessarily Alzheimer's or dementia. Yeah.
Okay. One here, do irregular periods in early years of reproductive age affect onset of menopause and other reproductive processes? This is our text line 22232. Send in all your questions now.
No, it has no relation. And other causes, of course, in early years need to be checked. You know, things like, hormones, what people call hormone imbalance. You need to look at ovarian cyst, and pap smear needs to be done. You need to look for things like polyps. You need to what are these causes of abnormal uterine bleeding? Because that is what now you are talking about. It has no correlation with the future onset of menopause.
Okay, that's good. Hi, menopause, does it cause depression?
Depression could actually be a sign of menopause. And then again, actually it works both ways.
Okay.
The fact that somebody is going through menopause, the things they wish they could have, or, and so it could cause depression. It works both ways. And it is important that it is actually managed in good time. Because again, remember, these people are also going through many changes in their life. So could menopause be the exact cause, or could there be other things that are contributing to the depression as well?
Absolutely. Our call line is now open. I had a couple of them coming in as I was wrapping up those questions. So go ahead, call us. I've paid for you consultation with a gerontologist and a gynecologist. When you knock on their door, you'll just be like, why didn't I ask that question on health check? Don't regret this moment. So go ahead and do that. What are some of the myths and misconceptions of menopause?
Interesting ones. That because somebody has gotten to menopause, sex is no longer important to them or for them.
Facial hair starts to appear on a woman who's getting menopause.
Facial hair.
Yeah, what happens is that when estrogen actually declines, there is, people become hairy. Yeah, so there is actually appearance of some facial hair. Not to everybody. Some people experience it. Yes, it's not, again, for everyone. It's just
Just
some
remember,
people.
none of the teachers. I'm sorry, George. Okay, so some of the myths you had.
Yes, I just want to say that I think people do need to understand the issue about menopause, because I know in our African setup, this thing, imekuwa baridi, yeah, which really now brings in many other things, having another wife or going out there to get, because amekuwa baridi, which is not the case. As Dr. Muthoni has said, it's another phase of life. And people have been together for all those years, and nothing lasts forever. It's really changing tactics. Yeah, sex will still remain, quite doable. And there are all those marital privileges, even the beauty. Even if they want to go dance, they can go dance. I mean, everything can appear. It's really, it's perception. It's how really it's taken. It's another phase of life. Just as many things, if you buy a new car today, within 2 years down the line, I mean, there are now more, more smarter cars, but yours can still be good depending on how you look at it. So I think this is something that is very common. People need to understand, especially us men, that they normally don't go baridi. They only change just like we are changing. Yes.
And everyone is changing.
Yeah.
Everyone is changing. Please, everybody is changing. If one starts menstruation early, does it result to early menopause? I don't know why. This is one of the myths, because this question has been repeated. What would you just respond to it again, because the person didn't hear?
Not necessarily.
Yes.
Yes. What happens early in menopause? What happens early when the menarche begins does not necessarily mean that menopause will also come early. Yes. There are many other factors in between the beginning of the menses and the pausing of the menses.
Probably I'd say people are calculating this way. If I started my period at 12, I count 40 years. So mine will be 52. If I started at 16, I add 40 years. Mine will be 56. It's kind of a myth like that, but it varies.
Yes, it depends on person to person. It's really not that if you start early, then you end early.
Awesome.
That is not the case.
Could there be side effects of hormone replacement therapy, or I go ahead with the treatment? Good show. As you talk about this, explain one more time what hormone replacement therapy is.
The HRT, hormone replacement therapy, is where you have used drugs. So we are saying that the core problem in menopause is you reducing you are reducing the estrogens, so they are going down. So when you're trying to talk about HRT or hormone replacement therapy, you want to replace the estrogen. And for a person getting hormone replacement therapy, they need very, very good care by a doctor who understands, probably who has done treatment of menopause using the hormones, because there is risk of cancer. And that is the main thing, the breast and the endometrial cancer, the uterus cancer. So there are a number of tests that we normally do. Okay, so we do the liver, you want to check the kidney, you want to do the pap smears, you want to do the mammograms, you want to check the uterus, and if possible, even do a endometrial biopsy, just to make sure that that lady, before you start the HRT, they are quite okay. And then once you start the HRT, they need very, very constant checkups of all those organs and those pre-cancer checkups as well, because there's a risk of cancer formation when you're using hormone replacement therapy.
Absolutely.
So I would advise her that she must have a doctor who understands this, and all those pre-checkups have to be done, and that kind of maintenance checkup to continue very, very carefully.
Absolutely. I'm still going through all your questions on 22232. As you do that, you're also welcome to call and consult. One is asking, with UTIs, what causes UTIs in menopause? What's the cause?
Could be many things. One, how well do you empty the bladder? Because again, people have a tendency of, okay, fine, you're supposed to empty the bladder, and then you decide, no, let me just hold a little longer. Then what happens? So, and then the other question is, does the bladder empty completely? Because when you empty the bladder, and some urine is left in the bladder, it actually provides an environment for bacteria to grow. The other thing is, what kind of innerwear does somebody use? And then again, how, you see, there's, basic hygiene. How do you, for example, when somebody goes to the washroom, how do they deal with their hygiene in the washroom? Because that is also very important. Again, remember, in the female structure, the urethra and the waist exits are quite close. So that means it's very easy to introduce infection when you're doing the hygiene post visiting the washroom.
Okay. So wash your hands before and after going to the bathroom. I know people think this is crazy, but when you get to the bathroom, wash your hands. When you finish, wash your hands, because you might bring yourself some chafu, you know. Okay, okay. So let's just take care. I guess that's the main thing.
It is important. Hygiene is very important.
Okay.
Yes.
Is there anything like that for andro? Just before we make sure we have an episode for andro. Pause.
Yes, in relation to what you lose as men, because men you not have estrogens, but you have androgens, and those are the ones. And just like the estrogens do, and she has elaborated very well, is that they tend to hold the organs tight enough. The sphincters, like the brakes, so to speak. Yeah, in andropause, in menopause, they become a bit loose. Okay, and therefore they allow now the bacteria from those other orifices, the anus and those areas. So out the prostate gland, the enlargement, which also becomes larger during that time,
Yes,
and therefore there's incomplete emptying of urine. So it is coupled with the andropause. So yes, it happens in men. Yeah.
Edwin is actually asking, thank you. It's more of a comment, commenting that thank you for talking about andropause as well. I'm sure our producer will find an episode where we can sneak it in and talk all about it. What advice would you give for completely emptying?
Don't rush it when you're in the washroom. Allow the urine to flow until it is completely empty. Yes.
Okay.
And then when you take in more fluids, it means you're likely to empty more frequently.
Yes.
Yes, just make sure that your fluids don't interrupt with your sleep. But you have the whole day to do that.
Yeah.
Yeah.
Okay, that's a really good remark on the issue of hormonal replacement therapy. And I think we responded to this, but probably you could just say it one more time. It's best not to treat menopause, but to support.
To support.
Yes.
Yes. In fact, that is the principle. You want to start with non-medical, non-hormonal treatment because of that aspect of causation of cancer, which sometimes, the follow-up you can miss. And follow-up is not easy to do. Things like mammograms, things like ultrasounds, there are all those factors that can come into the missing of the diagnosis.
Yes.
So we normally advocate that you want to do the non-medical, the lifestyle changes, the dietary, the exercise, making sure that your BMI, the weight for height is there, relax, sleep. Okay, then you can go into into supplements, the calcium supplements, the phosphates, and all that. And then if at the worst, then you can use soya-based compounds, which are not really hormonal. Before then, that special small group, those are the ones that you can now handle with the HRTs.
I hope you got that. Long-term effects of menopause. What mark is there?
Long-term effects. Okay, positive, you're not going to be pregnant, so you can enjoy your other things and you can also experiment and explore and actually reinvent yourself. The negative side is that, like we said, the osteoporosis is quite common. So it is important that you actually get into exercise, you look into your diet.
In layman's language, explain osteoporosis.
Osteoporosis is basically when your bones become weak.
Yes.
As in, you see when you have a sponge and when you have concrete, then the wall is nice and compact. The sponge has many big holes. That is how the bone looks like when you have osteoporosis.
Wow.
So basic things, taking a walk 30 minutes every day. You don't need to go to the gym for this. You just need to be physically active. Then look at your diet and what you're taking in. And then sometimes people can get very irritable. And why? Two things. There is the estrogen itself going down. And number two, there is a sleep deficiency because of the lack of sleep rhythm. So that's probably something that needs to be looked through or worked on over time. And then it is important that people stop. Okay, let me put it this way. It is important that people brush up on the social skills, make new friends, get to interact with people more often. It works both for the depression and as well as the depression, the mood, the irritability, and it also helps you. Remember when you talked about the cognitive decline or the memory issues? It works and helps So the complications may not really be as much if well addressed and well handled. And then as people grow older, urinary incontinence is one of what we call the geriatric syndromes. So if we support people well with and through menopause, the chances of having negative side effects are unlucky. So people can enjoy life.
Yeah,
Yes.
absolutely. So live your best life in this season. What would you comment on the same?
Yes, I would say that it's important for everyone to know that menopause is coming. And therefore, once you know something is coming, and also andropause is coming, once you know something is coming, then you're going to prepare for it and know the expectations, all right? So in terms of organizing your life, during menopause is not the time to start new business, it's time to enjoy hobbies and what you like most. The other thing, let people not think that once menopause starts, it's worsening. It's not like a malignancy, it's not like cancer.
I know, that's what I always thought about it, by the way.
Yeah, that will worsen and worsen, and the bones, you'll be cracked, all of them, you have no single bone or something. I mean, it's just like a tree or a car or anything, a TV. It has its own lifespan. And once we expect, and this is very, very important, that preparation bit, then we're going to know what are the things that we put in place, because this is coming, including financing. How shall we live? Yeah, I mean, shall we now be able to travel? Shall we have new hobbies, either some golf, because you can still be very active, play golf, swim. There's so many other things that you can do. So you need to package your life looking at now what menopause is bringing on the table. That's what I would say.
This is a very important question. The conversation is on menopause, something that's going to happen to every woman. There's no woman who is going to skip it. So we're going to go through this, so we better understand it. And I've heard Dr. say something very important: plan for it. Plan for that stage of your life, plan what you're going to be doing. The people who don't organize their finances past 50, they're just like, tukule, tukufe. Hata COVID imekuja, What advice would you give? And I also want you to chime in on this. Sleep habits. How can guys sleep train as adults? We're used to sleep training children, but we don't sleep train as adults. What would you say?
I think it's very, very important to understand the importance of sleep. Because I know, as people, we think when you're sleeping, you're wasting time.
Yes.
You could be doing something. The time now to work very hard and, to do some extra work to get extra income. But remember, sleep is very, very important in our health. It has a relationship to chronic diseases. It has a relationship to our mental health. So when you do sleep, you sort a lot of problems, including menopause. We normally say an average of about 7 hours is very good. And the other thing is about 9. Yeah? So the way we say we are going for lunch because it's 1, we should say it's 9 o'clock, it's time for sleep.
Yeah.
And then sleep and make sure that you sleep for 7 hours. We even discourage to use alarm clocks, because we should be able to develop our own biological clock, so that you're saying it's 9 p.m., it's time to sleep. And maybe by 5 or 6, the body will just say, I had enough. And then you wake up.
Yeah.
And then, of course, it has something to do with the meals. Yeah? Also plan the time, and this is very important in menopause, because in menopause, you're very tired, you have been in business, you have educated your children, you should never go to menopause or retirement with a loan, because you do not have enough energy to start running around.
Fact.
Yes. And therefore, you should be able now to relax your body, so that at 7 p.m., it's time for dinner, right? And therefore, now you relax a bit, you drink some water, chat a bit, you want to read something. So 9 is sleeping time. And therefore, the body will get used to that kind of a routine. And that's very, very important, the body. Never want to hijack your body. Because the more you hijack your body, the more you interrupt many systems. It's like a machine. And therefore, the more even other diseases, they say even other cancers can come as a result of that, disorganization in the body, and the hormones and the system in the body going disarray.
Absolutely. Thank you for that question. Do you want to chime in on this?
In addition to that, the sleep environment.
Yes.
Now that we are dealing with hot flashes, you can actually look at the kind of beddings you use. They should not make you feel hot. Actually, should actually make it easy. Yes. If you want to open It depends on what works for you. And then where you sleep, can you open a window to just have the room cooler, or whatever it is that you choose to do to have your space, your sleeping space cool. And then again, sleep hygiene, as in your bedding need to be clean and comfortable enough for you to be able to enjoy your sleep.
Let's talk about moms. You know, we're in an African setting. Mom ndo anamka wa kwanza. Everyone finds her awake. She's made breakfast, she's ready, and she's going to bed almost the last person. Let's talk about the support that she needs as we respond to Naftal, who asks, how long does menopause last on average? You will be responding to that. And ready in Kitengela, I see your question. This one will be answered after the show. Hey, another hot question. I'll give it to you. Ready, we see you. So, what would you say? How do we support moms? You know, mom is one who is going through menopause. The last we're just eating the food, enjoying.
I will say this, and it could be very controversial, but I will say this. For a mom to be there, they're either children or they're children and a father, right? Everybody needs to have something to do. It can be that everything is left to the mom. So what are the others doing? Eating and sleeping? It's not possible. So division of labor. You know, we learned that, but was it in primary school or something? Yes.
GHC.
It's actually one thing that needs to be brought on the table and discussed. That way, everybody is able to go to sleep at the same time, hopefully, and everybody is able to get the amount of sleep required for a healthy life. And by the time she's up in the morning, she is less irritable, she is more focused, she gives better service. So as in, for me, division of labor is important. Okay. Then again, we need to empower the moms to know that it is not for them to carry the whole world after all. So sometimes you just have to let some things just, you know. Yeah.
Okay. Do you have a comment on this?
Thank you, Dr. Ari. What I would say is, during menopause, you expect maybe a couple.
Yes.
Because the children are done, and maybe there could be a house help or someone. And even if there's no house help, this is a time that people should get to know each other more.
Yes, empty nesters.
Yes, empty nesters. So they should bond more. And this is a time anybody can cook tea. Anybody can even iron the clothes if there's no one to iron, and it's fun. You know, one is in the kitchen preparing something, one is doing something else, and people are, so that when it comes to sleep, people are sleeping together and waking up together. You can even plan and say, we'll wake up at 6 and take a walk, you know, in the driveway, or maybe we have a small gym in the house. Let's go do 30 minutes, you know, then we go shower. Then after showering, let's prepare. One is preparing some eggs, the other one is preparing a cup of tea. This is the way things should be. It's not a time to say, this lady, I'm just snoring, and snoring. The lady wakes up, sleeps at maybe midnight, at 6 a.m. We need each other. You should see what happens when one loses a partner. That man is normally very desperate, and they go looking for someone else as company, which is normally, they don't live long. If I'm start corrected,
that's true. They're
very, very stressed.
Wow. Someone asked, Naftal asked, how long does menopause last on average? And you had mentioned this.
It could last from 8 to 12 years.
Okay.
Yeah.
Between 8 to 12 years on average. Hi, Kerry. Can hypothyroidism or hyperthyroidism get affected more by menopause? Thanks for the informative show, Sami in Mlolongo. Thank you for watching, Sami.
Yes. Those are metabolic diseases, and they can actually be differential diagnosis to menopause. Hypo or hyperthyroidism, you know, the issue of, either depression, hyperactivity, sweating, you know, even hotness of the body, you know, loss of weight, you know, not wanting to talk to anyone. So actually those two conditions really rally very well with menopause, and they can actually be confused.
Okay. Do you have a comment on the same?
He said it all. Yes.
Thank you so much, Sami. I hope you're well informed. Remember, you can call us in studio live. We're ready to respond to all your questions and everything you'll be thinking. Lifestyle. We talked about home remedies. What about lifestyle? What changes?
We won't say anything really changes as much. But the thing is, a healthy lifestyle is something that everybody needs to adopt from an early age. So when you adopt it at an early age, you're able to carry it through to the next phase.
That's
However, you can still start working out then. You can still start planning your meals as needs, as per your needs. Then, again, remember, same things. You start planning your sleep properly if you had not been doing it before. Social interaction is very important.
Yeah.
It's the one thing that we really take for granted. You know, we are this generation, the
Later,
thumb
what
generation.
women's
Whatever you want to call it, be it a women's guild, be it a chama, be it whatever you want to call it, right? But what needs to be is that we need to learn how to socialize and actually build a network, as in a social network. Because this is, again, remember, a support system, which is important. And then again, when people are in that social support system and they're able to share experiences, it comes in very handy. Yeah.
Okay.
And it doesn't have to be men alone or women alone. That's actually time for people
to mingle.
yeah, think about it. You have a widow and a widower attending these sessions. What are the chances at the beginning? And you're like,
A fresh start.
good for health.
As you think about that, we're talking about raising your EQ, that's emotional quotient, during menopause.
I would say this is the time to go easy. And we have seen examples of, people in menopause, that's when they get busy. Some travel outside the country to go look for better jobs, and then they leave the other partner here, depressed and all that. So it's time to take it easy, to socialize. Again, it's time to make sure that you create time for each other. Because you have seen other people, you go to Chama, others you go to Women's Guild and all that, and the old man is left in the house, coiled. I mean, it's sad. Or the man will join the men, go alcohol, because the worst, and I've seen this, when one loses the other partner, life really changes. It's never the same. And therefore, you better know what you have, the jewel you have at hand, and take care of it.
Absolutely.
There's a story I like giving. So this guy is educated in the village, goes to university, then decides and leaves the wife in the village. So the children grow up in the village. Whom do they know?
Mom.
Who buys uniform?
Mom.
Who goes to school?
Mom.
Who buys bread?
Mom.
So now, when this guy retires, goes back home, which home is he?
Stranger.
When he goes there and now wants to order people around, everybody takes off. So, when you say you reap what you sow, or so this has to start again from the very beginning. Yes.
Sow the right things, sow the right fruits. What are some of the do's and don'ts? What did you tell someone going through menopause? Do not do this or do this.
Issues of eating because you want to feed your stomach or you just want to eat, mind what you eat. And therefore you should have correct nutritional advice.
Yes.
Yeah, that you want to reduce the portion of starch so that you can eat more vegetables, more fruits, you take enough water. Never take for granted issues of exercise. Don't say I'm thin enough or I'm this. Exercise is very, very important. And you don't have to do much because people scandalize exercising. They think unless you go to the gym and sweat, just something 5 minutes, even in the house, just small tummy trimmer, or even exercising a bit and stretching yourself. Do you know when you do that, it's like an engine. It's the way an engine runs. If you stop the car now, you leave the engine running for some time and then it cools. That's what happens in the body. If you do some bit of exercise, that continues for a number of minutes even when you stop. So they should make sure that they take care of the health, or whatever they eat, it's very, very important.
As you comment on the same, also add, are there foods to avoid during menopause?
I will not say avoid. I'll say moderate. If you're going to do your junk, we all love junk. It's a fact.
1 or 2 cheat days.
Yes, you can do your cheating just like you used to, if at all you used to. But if you used to do a lot of junk, it's a good opportunity to actually moderate your junk. The other thing is about alcohol. It has been shown that with menopause, it is important to reduce the amount of alcohol that one has been consuming prior to menopause.
Okay, here on Hope TV, we say no alcohol, 0, 0, 0, 0.
And for the smokers, remind them.
Let's talk to them.
Smoking actually can induce menopause. It's actually like sort of a known fact.
What determines the age for menopause?
It's biological.
It's biological.
Yeah, so you cannot really say.
Yeah.
It's like asking what determines when the sun sets or when the sun rises.
Okay.
We can really, point
tell.
to say and say it's this. It's a biological thing. Yeah.
Awesome. We're about to pick a phone call. Question to Daktari. Good evening. Thank you for watching Health Check.
Okay, my name is Rose. I'm calling from Mombasa. I have a question for Daktari.
Yes, Rose.
2 years ago, I was diagnosed with multiple fibroids. Then 1.5 years ago, I stopped seeing my period. Could this be menopause? And should I go ahead and remove the fibroids? Thank you.
Okay, we received your question. Rose, thank you for watching from Mombasa. Thank you for keeping it Hope TV, where you look and live. Daktari, you have a response? We have two Daktaris.
There's really no connection with the fibroids and menopause. Okay, she didn't tell us her age, but other reasons. We need to look at the ovaries, we need to look at the hormones, and definitely we need to know what her age is. Fibroids are only removed if there's a good reason. What we call symptomatic uterine fibroids. Either they are bleeding, they cause so much pressure so they keep peeing, or they are constipated, or they are so big they look like they're pregnant throughout. So when you have those reasons good enough to warrant the removal of the fibroids, that's the time you should go for the surgery. Yes.
Susan in Kirinyaga, good evening. Thank you for watching Health Check.
Hello.
What's your question?
Hello.
Hello, Susan. How are you? Okay, I think we've dropped that. Okay, sure. Go ahead and keep asking your question. What asking? Hi, Doc. My question is not related to the topic, but since you are doctors, I believe you have the answer to my question. Okay, so let me just ask it because they took their time to text it. Their friend got pregnant and they had a coil. How was it possible?
It is possible because the coil is not 100%. It's normally about 97, 98%. So there's still, a window
That
of
1%,
about
2%.
2%, for the coil, to fail. Other times you find even the coil is placed properly, but they still get pregnant. Yeah. Either they get heavy periods in clots, so that might dislodge the coil, or maybe at the point of insertion, maybe it didn't fit in the right place. So with those factors, it is possible.
Okay, but congratulations.
Yes, how?
That's what we say.
And they should not fear,
Don't
by the
fear,
way.
yes.
Yeah, we do manage. We can sometimes remove the coil if they come early in pregnancy, but many women coexist with pregnancy. They get healthy babies. So there are no fractures the way they say. There's really nothing.
Absolutely. We were on the don'ts before I picked a question. Did you respond to what people should not do at all? Are we clear on that? Catherine in Utawala.
Yes, I'm calling from Utawala.
Yes.
Yeah, I would like to ask a question.
Go ahead, please.
Yes, now I have not had my menstrual periods for 1 year now. Does it mean that I have started my menopause?
And how old are you?
Okay, I am 51 years.
51.
52 in September.
Yes. Are you having any other symptoms?
Backache most of the time. That's the main symptoms that I usually get.
Hot flashes and sweating?
Pardon?
Hot flashes and sweating?
Yes, hot flashes. I do get hot flashes once in a while. Yes, I do every day, at least once or twice a day.
Yeah, so menopause is starting.
It's menopause.
Yes.
Hello?
Yes, it is.
Oh, thank you very much, Silsa. So what am I supposed to take for the hot flashes?
For hot flashes, you said you can change your lifestyle, you can exercise, you can use some supplements, calcium, some phosphates, get nutritional advice, vegetables and fruits. And if it worsens, then we can give you soya-based drugs that are not hormonal. Those ones are going to help you. But most of the time, we do the non-medical. Those ones are going to help you.
Oh, okay.
Okay, Catherine.
Awesome.
Thank you.
Thank you. Catherine is now getting into this new phase of life. Please like her.
She needs to understand that, it's this other phase of life. It's not a medical condition.
It's not a medical condition. You repeated that.
Yes, we're not looking to treat. We're looking to manage the symptoms that come with menopause.
Yes.
And then again, it's a beautiful opportunity for her to do things that she could not have done if she was not, things that she could have wanted to do that she did not do because she was paying fees or changing diapers or So it's a new time to actually reinvent her.
Awesome. Let's pick Mary from Olkalao.
Mary, uliza swali, tunakusikia.
Nimerudi sana. I'm 53.
53.
Niko 53 years.
Endelea.
Yes, na nimepunguza weight sana. 7 kgs.
70
na
kgs.
nashindwa kama ni menopause ama ni nini.
Atumefikisha nini?
She has lost 7 kgs.
Oh, she's lost 7 kgs.
Yeah.
Okay. Do you have any follow-up question?
She's asking whether it's menopause
I'm
or
53.
what.
Yes.
And she's 53.
Anything to do with her weight to reflect menopause?
It may not necessarily. Si lazima ikuwe ni menopause. And it would be important we figure out why the weight loss. Yes. Being 53, losing weight does not necessarily mean it's menopause.
Okay.
Yes.
But average age for menopause is 51.
51.
So she should anticipate it and celebrate it when it comes.
Yeah, take it.
Yes, yes. But as Dr. Muthoni says, Mary, enda kwa daktari. Inaweza kuwa ni ugonjwa wa sukari, inaweza kuwa ni shida ingine.
Okay.
Kwa hivyo lazima uangaliwe na daktari kwa sababu sio ikuwe ni menopause.
Okay. Susan in Kirinyaga.
Niko na swali.
Endelea.
I'm Susan, I'm from Kirinyaga.
Yes, Susan.
Na niko na swali. Nataka kuuliza Daktari Muthoni.
Yes.
Kuna mimi mbibi wa pili. And my co-wife.
Yes.
Ni ako na cancer ya uterus.
Yes.
Na swali nilikuwa nauliza kama naweza shikwa na hiyo ugonjwa pia. Mimi kama we are sharing one husband. Hiyo tu ndio nilikuwa nauliza.
Hapana, cancer ni kiwango ya magonjwa ambayo hayaambukizanwi, what we call non-communicable diseases. So kwa hivyo si lazima utapata. Na pia risk factors ambazo anaweza kuwa nazo si lazima iwe uko nazo. So huu si ugonjwa wa kuambukizanwa. It is not a communicable condition.
Okay. Did she mention which form of cancer?
Yes, cancer of the cervix.
Of the cervix.
Uterus.
Okay.
Of the uterus, sorry.
Of the uterus,
Yes.
okay. But for cervical cancer, there are few speculations here and there that perchance.
Oh yeah, cancer of the cervix is now an STI cancer.
Okay.
Yeah, but
Okay.
not the
Not a uterus.
Not the uterus.
Yeah.
You will be fine, Susan. Thank you for the question. Asante sana kwa kutazama Hope TV, where you look and live. It's been a beautiful conversation, and I have a whole new perspective of another level of life that I'll get to once I finish making my 7 babies. So, Daktari, are you ready?
Yes,
So, for now, how do we wrap this up?
You see, the way this is probably a beautiful dress and a pair of shoes that you have wanted to have all your life. And what happens when you get it? You wear it with pride, right? Same case. When menopause comes, it's part of life. It's not a condition to be treated. Wear it.
Dr. Muthoni Gichu, Gerontologist, where do guys find you?
You find me at the Ministry of Health.
Okay, that's where you practice?
Yes.
Okay. So tufike tu hapo kwa gate?
Yeah,
Tuambie-
mtafute tu.
Okay, so
You find me in Afya House, room 401.
awesome.
Yes.
Afya House, room 401. If you need to see a gerontologist, first time saying this word, I've been reading it, never said it. Exciting to meet one of you. How many of you are you in Kenya?
Currently, I am making, you know, it's when you're walking in a forest and you have to cut a few trees so that people can
You're
have a way
chatting
to
them
walk on.
back.
Yeah.
Oh, she's a superhero. Nice to meet you. Awesome. Daktari,
Yes.
what final words would you give our beautiful ladies, men, whatever it is you have as your closing
Yeah,
statement?
the gynas are many, so.
No. We still
Anyway,
appreciate you. We appreciate you.
Yeah, let me say this. I think it's important for all of us to know that we should have benchmarks in life. You know, let's not make it monotonous that we say that we are ignorant of the fact that menopause will come. I like what she said, a new phase of life. So let's plan for it. Yeah, let's say up to this age we stop. You know, you cannot make the whole world in this world. I mean, you have your share that you do. I mean, you have your things that you do. You have your car that you can drive, a house that you can. So let's appreciate benchmarks in life and let's plan so that we can be able to enjoy. Because menopause can be enjoyable as we make it.
Absolutely. Can a woman have a child after 35? How safe is it? That's John in Siaya. Could you just respond to him?
Oh, 35 is young.
It's very young. Yeah, I'm almost 35 and I'm just 30.
You're just thinking of having your 7, so...
Yeah. Awesome. 35 is an excellent time. Prosper. Do your thing. Hi, I'm Mary from Nairobi, 46 years. I have missed my period for the last 1.5 years. I have had some hot flashes for a while, then stopped. Of late, I'm having quite thick discharge. What is the problem?
I think 46 can be premature menopause, so they need to find out. It's early. I mean, yeah, of course, we see some women going to menopause at that age. But before we say it is menopause, can she visit the doctor and find out what is happening to her
and even
body?
The discharge, what
and
is
then,
that white
and then
discharge?
of course, the discharge coming from the private area, could it be fungal discharge? Have we done a pap smear? What is the ultrasound saying? How is the uterus? Because again, that age is now age for other serious, diseases. So they need a thorough checkup before you can decide, yes, it's menopause that has decided to come a little earlier.
Absolutely. Mary, Nairobi, we hope that you, take this seriously and seek and consult. Thank you so much for your time. I pray that God will bless you, protect you from COVID-19 in this third phase, and just take care of yourselves. Thank you so much for watching. Remember, you can share this video. Somebody needs to hear about this. They need to be encouraged that they're not alone. They need to learn. So you can participate by just clicking that share button. If you're watching us on Facebook, if you're watching us on YouTube, share this with your contacts. Everybody needs to know about menopause because a woman in your life will go through it. Lazima apitie. God bless you. Have a lovely evening. Bye.